diabetic patients, this compensatory mechanism might be affected and they can drop their blood pressure, postprandial drop. That can be one of the reasons for the tiredness you feel after having food. अच्छा, तो फिर GLP-1 का कुछ data है to counteract that. So, what is the prevalence? So, this is the systematic review. This is a relatively new thing. Systematic review and meta-analysis. You can see the prevalence varies from 9% to 60%, particularly in elderly patients. And so much so that there was a meta-analysis of CV outcomes, although the number of studies were not great, and it showed that if you have a postprandial drop of blood pressure, you have got more all-cause mortality and CV events. Because your blood is, your heart is not getting the blood, it's being stolen away from the heart. So this is the data with an intravenous GLP-1 receptor agonist. Now you can see here, these two are healthy people and these two are patients with diabetes. This is systolic blood pressure, diastolic blood pressure. After a 75 grams glucose drink, the systolic blood pressure drops, the IV GLP-1 doesn't make an impact. But for diastolic blood pressure, it does make an impact. For diabetic patients, however, see the drop is here. It dropped in systolic and diastolic, both are here. But if you take the GLP-1 receptor agonist, there is no drop now of the blood pressure, both the systolic and the diastolic. There was a study with subcut lixisenatide, again, which suggested that this is the dark one is lixisenatide. There is no drop of blood pressure. So here, with the placebo, there is a drop. Placebo, there is a drop, both in normal people as well as patients with diabetes. So maybe, I'm just hypothesizing here, maybe this is one of the effects why some of my patients, when they said, I don't feel tired and sleepy anymore after having food.